Hey everybody, John Malanca here, United Patients Group, and just finished a very informative podcast with a return guest, Claudia Miranda from the Don't Punish Pain Rally organization. She was joined by Dr. Arnold Feldman, and they spoke about patients' rights with opioids, the pain patients' rights with opioids, but also the rights of the doctor who are being red flagged and blackballed by our government and being scared into not prescribing patients the medications they need, and the patients that are not being prescribed because they're on the red flag list as well. Claudia is a pain patient herself. She's been fighting Crohn's disease her whole life. And so it's an informative show. I hope you enjoy it and what they're doing for you, the patient, as well as the doctors that may be watching as well. So enjoy it. Please write your comments below, like us, share us, as well as subscribe. See you then. Bye-bye. Welcome back, everybody. This is John Malanca with the United Patient Group. Be informed and be well. Today I have a return guest, dear friend of the show, Claudia Miranda. Hey, Claudia.
Hi, John. Thanks for having me back.
Thanks for coming on. And then Dr. Feldman down there in sunny Florida. So he was
John,
thank you retired and went south.
Yes, sir. Thanks for inviting me. I appreciate
it. Thanks for being on. This is a serious topic. And so, Claudia, I'm going to read your bio here and what you do. Claudia Miranda is the founder of the National Don't Punish Pain Rally organization. Claudia is a retired court reporter, self-published author, and is from East Providence, Rhode Island. As a person living with severe Crohn's disease as a child, she witnessed firsthand the challenges a person with pain encounters when trying to obtain adequate pain management. Claudia, in 2017, created the Don't Punish the Pain Rally organization, focusing on organizing protest rallies throughout the country for people with pain who can no longer access pain management due to the 2016 CDC opioid prescribing guidelines. She started with 5 members. Today, there are 1,000 members across the country with chapters in Canada, Australia, as well as the United Kingdom. And Claudia remains vigilant in bringing awareness to the anti-opiate crusaders, who are profiting off the overdosing epidemic. Today, Claudia works with doctors throughout the country who have been targeted unfairly, and this is what she's doing with Dr. Feldman, by governmental agencies and medical boards. And so welcome, Claudia. And then Dr. Feldman, if you want to share a little about your bio. Sorry, I don't have that up here.
Well, I would be, I'll try to keep it short.
Cool.
You mentioned in your introduction to Claudia, she has firsthand knowledge of the problem because she suffers. Now, I did not have firsthand knowledge until I became a medical student, which was in Philadelphia. And so I was at the Medical College of Pennsylvania way back in the day before there was anything known as pain management. It did not exist. In other words, during those times, all doctors considered it their duty to take care of patients in pain. And it was only in the 80s that doctors became more serious about it. And there were a lot of reasons for that, but let's forget about that. So pain management emerged as a specialty. Now, I have been in it since the beginning, before there were pain clinics. I had the first pain clinic in the state, arguably the first pain clinic in the state of Mississippi and the state of Alabama way back in the 80s. And people, they respected what I was doing, but obviously something changed along the way. So there was this awareness, like a renaissance of pain awareness. And this is what we're dealing with today. And now there is a anti-pain movement, which has become very powerful because of things that we'll discuss. So I became an anesthesiologist, moved on from medical school to an internship in internal medicine at Thomas Jefferson, which is a very excellent medical college in Pennsylvania, Philadelphia. Then I went to Harvard, and I was lucky enough, I don't know why they accepted me, but they did. And I completed my training in anesthesiology in Boston, moved down south, went into the private practice of anesthesiology. And within a couple of years, I opened the first pain clinic because there was this definite need. People thought I had the skills, and I became a pain management specialist and I did clinical anesthesia for surgery for 15 or 20 years. And at the same time, I did pain management. And around the year 2002 or 3, I dedicated 100% of my time to pain management. Built a clinic, of which I don't think there were very many like it in the United States. I went back and traveled all over the world to learn to do spine surgery, laser-based, minimally invasive surgery, and innovated a number of things. So I've seen, I think in the movie Mommy Dearest, I think Joan Crawford said, Faye Dunaway said, "This ain't my first time around the rodeo, fellas." So what we're seeing now is just, we're back in 1914. So that's why Claudia and I met, by the way.
And thank you for that bio there. You know, why did it change? Because you started off saying that this is the day when doctors really took care of their patients when it came to pain management, and you said it kind of changed in the 80s. Was it due to Reagan, or what was the reason behind that?
Well, obviously there was a lot of reasons, but one of the things, obviously, advances in science, can and often do cause changes. So most of you wouldn't be aware of this. It's such an esoteric point. But in the 70s is when people experimented with the intraspinal use of morphine in rats. And researchers found that tiny doses of morphine applied to the central nervous system can cause pain relief without any mental changes, any dysphoria, any sedation. So guess what? Ronald Reagan gets shot by John Hinckley, and who I believe he was the first American to receive a shot of intraspinal morphine, Ronald Reagan. Well, I read about this in around 1981, I think.
Yeah.
And I thought to myself, well, if this is good enough for the president, why isn't everybody using this? And after some research, I wasn't the first, but we started using what we call neurally applied opiates, meaning opiates applied to the central nervous system via the surgical implantation of pumps, spinal morphine pump systems, of which I became very expert and very, very convinced that there is a better way to take care of pain. Well, at the same time, with that awareness, there were some changes in the pharmacology of opiates and the introduction of newer drugs. When I say newer drugs, we're talking about OxyContin, which is an old drug repurposed in a new package, meaning oxycodone, been around since 1920s. Fentanyl, which had been around since the late 50s. I used it in surgery all the time as an anesthesiologist, literally every day. It's a great drug if you know how to use it. It was never intended obviously for street use. So there became this awareness after Reagan that we can do a better job. The pharmaceutical companies that make drugs sell their drugs, and they marketed them in the beginning, I think, appropriately. And then there was this overzealous marketing of well-intended drugs or safe drugs that now are, as they say in Germany, verboten. So we cannot speak of these things. We cannot use these things. We cannot use them for their intended purposes. So for lack of a better term, there's been a backlash, as there often is, and the pendulum has swung the opposite way.
Yeah. And Claudia, thanks for your patience over there. You're like, hello, I'm here. So,
No, not at all.
Sorry, Claudia. Sorry.
Not at all. I love it. That's music to my ears whenever Dr. Feldman speaks.
Well, good. First off, I have to applaud you because not too many people stand up for their rights. And what you've done with your Don't Punish Pain rally and your followers, I do applaud you, because a lot of people just sit back and go, oh, this is the law, I have to just take it. And then you go into a slump of depression, and I've talked to many patients who've gone through depression. Some are no longer here because of suicide or whatever. And, so I know you're in pain every day. I know we've had our colleague and friend Beth Dost on here. She's in pain every day, a fibromyalgia patient. And you guys shared what a lot of pain patients going through when they go to refill their prescription. It's kind of looking. The pharmacist looks at him like, yeah, okay, I'll fill this for you, but I know what you're really up to. What do you really know what I'm up to? Do you sit in my body every day? I mean, Beth wakes up at 3 or 4 in the morning to get out of bed at 6:30 in the morning to talk about pain, and so I applaud you is what I'm getting on that too, of what you've done. What can you add to that? I know you're very involved since the last time I had you on the show, and a lot of things have changed. Can you share what you're going through right now, and some laws that you're trying to have passed, and some people you're fighting, I guess, if you want to say?
Sure. Yeah. Well, things change daily, but not much changes for the pain patient, because the plight of the pain patient goes unnoticed, unheard. Yeah. Nobody cares. And, one of my very first interviews I did years ago was a retired senator, and he said, nobody cares until it happens to them. And that resonates greatly, because I've since advocated for several lawmakers in Rhode Island who have been become victims of the pain patient genocide. I started off with 5 members on the Don't Punish Pain Rally organization, and we just hit 17,200. And that's just on one page. And now I'm on all social media platforms, but the requests come rolling in 24/7 to speak with myself, to speak with Dr. Feldman. Yeah. And we, in Rhode Island, I've been fortunate to get legislation sponsored. I believe it will pass in 2021. We resume session, but that's just a very small part. What I do in Rhode Island is I keep a lookout. I monitor what's happening with the state's medical boards. Are they terrorizing doctors unfairly? Is the DEA in my state? So I am definitely a squeaky wheel. In 2021, I am committed to investigating prosecutors' investigations, because I see the trash that the Department of Justice puts out. I've sort of shifted gears to working with doctors who have been targeted, because without a doctor, there's no patient. And Dr. Feldman, one of the very first conversations we've had, when I've met him, we've not met in person, but Dr. Feldman and I speak on the phone sometimes 5-10 times a day, a lot. And he said, as long as there's fair in the clinic, nobody will prescribe. And I know your wife was a sufferer. She was quite ill. And when these 2016 CDC guidelines were created, people with cancer were to be exempt. But we knew that would not, we knew eventually people with cancer will be stricken, and they have been. It doesn't matter if you have cancer. It's no longer the holy grail of illnesses, whether you have cancer, sickle cell, a rare disease, Crohn's disease, colitis, fibromyalgia. The government does not care. And they have targeted doctors who prescribe. And, one of our goals is to get a DEA oversight hearing. Another one of our goals is to get a copy of my bill in all 50 states to protect doctors. Dr. Feldman, because of Dr. Feldman, there's now a class action lawsuit that's been filed against CVS and Walgreens for discriminating patients at the pharmacy counter. And unfortunately, our country only responds to litigation. Litigation they shall have. So isn't that the truth?
At the beginning of this, you said, hopefully you're helping laws pass. What laws will pass?
So Rhode Island, the bill number last year was Rhode Island House 7398. And that bill states chronic intractable patients shall be able to receive long-term opioid therapy exempt from the 2016 CDC guidelines. And the guidelines are being rewritten. A lot of people don't realize that. And they'll be released in 2022. But they were created in secret, and the FDA distanced themselves because they knew this would be a horror show. It's very, very bad. It's a very dire time for people who are sick. And all the media wants to cover is the opioid crisis. We can laugh because we say, what opioid crisis? In 2019, Guess how many overdoses had pain pills in their system? 0.
Wow.
So people, and there's not enough awareness being brought to what people are really overdosing on. And as a mom to 2 teenagers, that's something else I had to fight really hard to get in Rhode Island, was to get PSAs put out by the Rhode Island Department of Health talking about fentanyl, because I've got 2 teenagers and, in their mind, they think people are only overdosing on pain medication, and that couldn't be the furthest thing from the truth. And that's why we have to work so much harder. We have to work to change the false narrative surrounding the safety and efficacy of opioids. And we're doing it, but it's at a glacial pace. So it's pretty dire.
It is. And Dr. Feldman, earlier when Claudia said my wife, she passed of pancreatic cancer in 2000.
Oh, I'm so sorry.
And talk about the pain. She was someone who didn't drink, didn't smoke, worked out, stayed healthy. And, 3 blood tests came back 0 cancer. I mean, that's how awful pancreatic is. But I remember we came back from Stanford University and they prescribed Corinne a higher dose. I think the first one was 5 milligrams. This was 25 milligrams. And I went straight to, after that appointment, to our local CVS. And sorry, we can't fill it because you already had one. I'm like, do you really think we're faking this right now? So I remember coming out the car with just tears in my eyes because I spoke with the pharmacist, the lady there. I said, this is my wife. And she ended up giving it to me. And I remember going in there after she passed. I said, I just want to thank you. This would happen. She just felt, she's like, our hands are tied. And it's awful when hands are tied. And it's awful when I hear patients that go back to their doctor who prescribed them the first round of prescriptions and or pharmaceuticals, and they won't refill them. What do you say? Is that the doctors? Are those the doctors that you're fighting for because they're being threatened?
Well, let me say this. All doctors have a basic education in medical school, but we all develop certain skills and we go down certain paths. Okay. So I had certain skills. I could, for somebody like your wife, I could do celiac plexus blocks. I could put epidural catheters in. I could put spinal pumps in. had a lot of tools in my little black bag, so to speak. Yeah. Now, not everybody had that, right? Now, I'm not a brain surgeon. I can't do brain surgery. I can't do heart surgery. I probably could, but I've never done it. But let me tell you the tie that binds, okay? The tie that binds in the pain, in the treatment of really serious pain. And I'm not a big proponent of this, but I have to tell you the truth. What is the tie that binds? I'll give you an A-B choice. It's either aspirin tablets or opiates.
Opiates.
Okay, so any patient that suffers from severe intractable pain can be made better. And when I say made better, I don't mean cure, but whose life can be improved by the judicious use of opiate medications. And that's a big if. Now, who decides? The problem we're having right now, it can be said in 2 words and then /3 letters, judicious use. And the 3 letters are Department of Justice. Why is the Department of Justice in the practice of medicine? They have no, in my opinion, they have no legal authority, which has been borne out in the courts. But remember, I said earlier in this conversation, I'm a Jewish person, right? So how is it that the Nazis did everything that they did in one of the most advanced civilizations that ever was on this planet? It's because people without authority seized it. And that's what's happened to the chronic pain patients. It's no longer a medical problem. It's a legal problem. If that makes sense to the audience.
And pretty powerful analogy, by the way. So thank you for sharing that. What happens to the patients? And this happens, Claudia. I know a patient that you and I are friends with that has gone in and to go refill their prescription, and on day 28, and the pharmacy says, "Sorry, we gave you 30 pills. But we need to wait, 2 more days." It's like, how can you gauge, how much pain I'm in on a daily basis? This happens in the cannabis industry with Epidiolex. I work with a lot of families. One of my dear friends, her daughter has autism and seizure disorders, and so they are prescribed. So in the cannabis industry, Dr. Feldman, doctors can recommend medical cannabis. Now that the government got involved and put a cannabis product, a true cannabis product, available in the pharmacy, they can prescribe it. So they said, sorry, we can't refill it now because you should have 2 more days on your Epidiolex. Mm-hmm. But they don't know. It's every patient's different. And the same thing with the pain patients. Every patient is different. Walk a day in a pain patient's shoes. Thank goodness I don't have pain. You've shared your pain. What do you say for those doctors or the pharmacy that won't fill those? And what do you share? What can you share with the pain patients that are listening that are in the same boat? That's why you get so many people that call you and contact you on a daily basis, because you step up and you let them know they're not alone. I mean, when Beth shared that she has fibromyalgia on the show, everyone contacted her. It's like, oh my God, I'm having the same thing. I thought I was alone. And so you standing up for patients, I applaud you. I said at the beginning, you talk about PSAs with your children, your Don't Punish Pain Rally website. You have a whole section of files from flyers, how to create a flyer, the handouts. I mean, is this self-funded?
Oh, yeah, this is self-funded. The Don't Punish Pain Rally is not a nonprofit. We accept donations at the Doctor Patient Forum, which is a nonprofit organization. The Doctor Patient Forum is run on blood, sweat, and tears, and we have to protest. The next time, I just actually organized my finale rally. That's my last rally. But I will organize one protest a year in DC, and we protest in October of 2021, providing things with COVID. We have to monitor that situation. And that is called the 500 White Coat March. And we want doctors to attend. Doctors don't have a voice. And, when you go to the pharmacy, one day before you're supposed to get your medication filled, that could actually trigger a doctor getting raided because there's such stringent guidelines. But most people don't understand, if you call CVS and ask for an early fill, you could lose your pain management.
Wow.
If you use cannabis or kratom, you will lose your pain management because cannabis is not legal. So, for your listeners, they need to be aware, if you have a contract with pain management, cannabis, THC, CBD, kratom, melatonin in some cases are all no-nos, because you've got a police officer who's writing your script for your pain medication. And it's just a disgusting attack. Let me say this before I forget. Dr. Feldman is the only doctor in the country who gets on the phone with patients.
Wow.
And because these people have nobody, and oftentimes we are their last phone call before they attempt to take their life. And we have to talk both doctors and patients off the rails. Once a DEA terrorizes a doctor, they're robbed of their livelihood. And your state's medical board in California, I'm going after them big time right now because of that horrible death certificate project. That was Kamala Harris's baby. The death certificate project was looking into doctors who had overdoses 10 years ago. And some of these doctors didn't have overdoses. Some of these people died from natural causes, but the DOJ, they're such cowards, and they have such weak cases that they lie. And now I question, are our federal judges being paid off? The corruption is never ending. And at the end of the day, we have lawmakers, judges, prosecutors, doctors. We have people who are profiting off the fake opioid crisis. But I know something will give, because everybody gets sick. 1 out of 4 people will get cancer. 1 out of 4 people will need pain medication. But these hateful anti-opioid crusaders, they lost a loved one to an overdose. So therefore, if you need pain medication, you must suffer. But now I get requests for people who tell me, my son overdosed, he's dead. He overdosed on fentanyl, but I can't get pain medication. This was not supposed to happen. My son's death should not be a reflection of the pain patient suffering. So we're seeing more conversation, but mainstream media, they're gluttons. They refuse to cover what's really happening. And it's, you know, it's disheartening because, you know, this past week I felt like, you know, there's nothing rewarding about what we do. Yeah. We're unique because most nonprofits can see, you know, what's rewarding for us is, okay, they didn't blow their heads off. So that's good, but there's nothing rewarding. But if we don't do it, nobody else will. People are afraid of the government. I am not afraid of anybody. Yeah. Well, no, I am.
How tall are you?
My 19-year-old, yeah. I'm afraid of her, John.
Well, how tall are you?
Oh, I'm 5'2", 120 pounds.
See, and you're King Kong, and I love that. Beth is like that as well. You know,
yeah, we don't. Oh, no. And my mom's in the next room. She's 85. And I did a TikTok video yesterday about this. One time, like 7 years ago, a doctor accused me of pain catastrophizing. I was admitted with a bowel obstruction. Yeah. And I could see the look on my mom's face. And I said, oh, my God, this poor guy better run. Because my mom said, how do you have kids? And he said, yeah, I have a 6-year-old. And she said, does your 6-year-old have an NG tube in her nose? And he said, no. And my mom says, well, my kid does. So when your kid has an NG tube in, you give me a call and then I'll tell you that your kid is making up for pain. So you have to force people to do the right thing. My approach is a little unorthodox, but that's all we've got.
Well, you're also a mom too, you know, and you're tough. And I think your approach comes from, you'll do anything for your child, and in turn will, you know, really stand up and get your rights heard. I want to go into rights, but I also want to go into pain doesn't discriminate, disease doesn't discriminate. And that's something that we share even in the cannabis world. You know, cannabis wasn't our lifestyle. And Dr. Feldman, I don't want to surprise you. This is a podcast. My company is United Patients Group, and we are pain advocates or health advocates as well. You know, helping people avoid the tangled web, whatever it may be. If it's cannabis is it, if it's going through opioids, if it's going through health and wellness. And so we were thrown into this in 2011 when my father-in-law was diagnosed with stage 4 lung cancer, metastasized to his brain. He was given weeks to live, and we asked about cannabis for appetite stimulation, not knowing the benefits, and the outcome, he's still alive, you know. And so we've seen, and like Claudia, it's like, wow, you know. And I mean, I called Corinne Mary Poppins, didn't drink and didn't smoke type of thing, but it doesn't discriminate. You know, pain and cancer and ailments do not discriminate. And so you helping the senators, and that's one thing. We've had senators contact us, say, you know, I was so anti this, and we were thrown into this world, and now we're proponents of that. And same thing, it sounds like that's happening with you. Our doctor recommended a doctor in Mexico who was based in LA because he was constantly in court fighting for his patients' rights. And he said, you know what, I'm out of here. I'm going to go down. And he's been down there for 19 years, and he has patients from all over the world to come. He goes, and I don't have to fight the DEA anymore. But he goes, every time I spent more time in court than I did, talking about litigation, more time in court than I did with my patients. And I spent all this money. I won, but what did it get me? I spent all my time in court. So I'm not going to do this. Your rallies, this is where I was going about justice, your rallies and your protests, and you have your 500 white coat rally. Do those rallies go anywhere? Does anybody listen, or do they just look out the window and go, here they go again? I mean, what really, can you share?
Yeah, well, you know, the reason I created the rallies was to get help to the elderly at home. And the only way people find me is through word of mouth. Yeah. And each time the media would cover, local media stations would cover the rally, then if you're at home, you'll see that news, that 10-second news about Don't Punish Pain rally. And that's all they need to see. And now they can connect with us. So the rallies are necessary, but we don't have a great turnout because a lot of these people, they're bedridden and and virtual anything doesn't work. That's a big flop. When people say, oh, let's do a virtual, I don't do anything virtually. No, in person. So, it's done something because I started with 5 members and look, once you go over 3,000, 4,000, 5,000, you don't even know most of the people, but we have original members and they ask, well, is it worth fighting for? But you have to fight. So, and you have to protest. You have to be out there. You have to attach a face to the cause. And step one in this whole process is bringing awareness to the issue. We don't have the money to pay for a national PR campaign. But if we had $5 million, we could do a lot with it. We don't take money from pharmaceutical companies, and we can't for the time being because of these hateful, evil people like Andrew Kolodny and Prop. And these people take millions from pharmaceutical companies, but they accuse the pain advocacy groups, oh, well, they get money from opioid manufacturers. Well, so do you. So it's just one attack after the next. The rallies are necessary to bring awareness because we have the numbers and we have something no other community has. We have the numbers. 50 million Americans suffer with chronic pain. And when taken as prescribed and stored correctly, opiates are safe and effective. And if you need cannabis, you should be able to get cannabis. And if you need kratom, same with kratom. But you can't get anything now.
So when you were on last time, I had a lot of people write in as well as doctors saying, come on, opioids, they lead to other things. They lead to death. People just want to get high with it. And we get that cannabis industry.
If you're an addict, absolutely. Because I advocate for people with addiction. So if you're predisposed to addiction, you have to, and that's why they're prescribed in a controlled setting for that reason. But if you're predisposed to addiction, you will probably get hooked on opiates if not taken in a controlled setting. But the government's taken away the right to even see a doctor. Now doctors just won't prescribe. They're like, forget it.
And what do you do there?
Can I make a comment about that?
Of course, please.
This is all based on false science. So I remember a long time ago, you remember there are some basic medical specialties we think of: surgery, gynecology, neurosurgery, internal medicine, cardiology. So now there's a specialty, been around a couple decades or maybe 3-4 decades, addictionology. You've heard of it. I'm an addiction specialist. Well, I talked to an addictionologist many years ago in the 80s when I first started doing pain, because occasionally we would cross paths where a patient, you would find out this patient was really an addict, not a pain patient. And it was, it was a learning experience to learn, because remember, to be an addict, you have to be able to fool a lot of people. So this addictionologist in Mississippi, believe it or not, that's where I lived. He said to me, we were working together to help this. It was a nurse. And he said to me, Arnold, take this as gospel. You cannot make somebody an addict. They're born an addict. And it's just their choice of substances or their choice of behavior. So I took that very seriously, meaning addicts are going to be addicted to something. And so when you make these substances or you have a prohibition-like system, then these people get into trouble because in order to access their drug of choice, they have to access illegal activities. And that's why our prisons are full of people that should not be there. Now, there's a field now that's developed called harm reduction.
Yeah.
And harm reduction is kind of, and I don't agree with all of this, but harm reduction is kind of like confession in the Catholic Church.
I was
I'm
going
an
to ask you.
addict.
I don't think you're Jewish. I think you're on a Catholic over here because you said
Well,
a
I
couple
probably am.
the gospel, heaven, and now you're talking about. So
Yeah. Well, you know,
I see that halo over your head too, Dr. Feldman. I don't know.
Jesus was Jewish too, you know.
Oh yes, yes.
So the harm reduction specialists say, or the harm reduction believers say, we have a problem, meaning addiction, and we just have to deal with the problem. We're not going to even worry about curing these people, at least in the short term. So what has happened, and I want the public to understand this. Somebody said a long time ago, I don't know who it was, if you want to know why something's happening, follow the money, right? Follow the money. So pain patients are a big pot of money. Either Medicare expenses, Medicaid expenses, private insurance expenses, workman's compensation expenses, disability payments, pharmaceutical companies making money, medical device companies making money. So they want the money, but they really don't care about the human being. So what has happened is Andrew Kolodny, who's just a front man for a bunch of how should we say, unethical pharmaceutical companies, looked at the Purdue company, a Jewish family that made a lot of money selling OxyContin. And that's a whole different issue. Obviously, I don't know these people, but I've been around since the beginning. And they saw the billions and they said, we want those billions. And now what they're trying to do, and they're becoming successful, is to substitute a drug called buprenorphine, Suboxone, and force millions and millions and millions of Americans, including people like you and me, Claudia, my wife, people with cancer, people with all kinds of problems, force them to take this drug. And guess what? Remember in Brave New World, Aldous Huxley novel, we all read it in high school, to keep people calm, they gave them a drug named Soma. That was the name of the drug in Brave New World, 1937. So buprenorphine is the new Soma. And how did they achieve this goal? And they stand to make billions of dollars. I'm going to tell you a deep, dark secret. They hired influential former congressmen and senators and governors to influence the Department of Health and Human Services to change one diagnostic code in what's called the Diagnostic and Statistical Manual 5, DSM-5. They changed one diagnostic code to opiate use disorder. So, for instance, you mentioned your wife, may she rest in peace. She took an opiate for more than a week, but rather than say her diagnosis was pancreatic cancer, they would say she has an opiate use disorder. So if you make a drug which is meant to be taken by addiction patients, which is 2 million Americans about, and you extend that to 100 million Americans by changing the classification and coding, guess what? Your corporate income goes up 50 times, and it's lifelong. So that company has the potential to outpace Apple Corporation, because you don't need to buy an iPhone every day, but you have to take your Suboxone every single day. So this is the biggest ruse that I personally have ever seen. But the good news is Claudia and I are going to sue these people shortly. And we have a research department, and we are collecting information that you're probably not old enough. Do you remember Abscam?
You're talking to me or Claudia? I think I'm older than Claudia.
They entrapped a bunch of New Jersey congressmen in taking bribes from Arab businessmen.
Yeah.
Do you remember that?
Yeah.
Well, this is bigger than Abscam. This is billions and billions and billions of dollars. But they got President Trump so jacked up on this that he declared the opioid crisis a national emergency. You know what? The opioid crisis is man-made. It is not a Ebola virus pandemic. And we can change it in one fell swoop by a presidential order or a piece of legislation saying the following: Doctors can prescribe medicine, law enforcement officers cannot. That is the conversation we need to be having. So it's just like marijuana. If you go back to, the old movie, Harry Anslinger in the 30s, Reefer Madness. I mean, come on, the jails are full of people with marijuana convictions. So now they're getting full of doctors that compassionately treat human beings. And if we don't put a stop to this, our society that we know will no longer exist.
A lot happened in 1937.
Yeah.
Actually, my mom was born as well. What do you say about and I'm going to take this other side here. I should say bring this up because this was brought up in the last time I had Claudia. I mean, what do you say about all the rehab centers here in California, Napa Valley, all the way down to Malibu? That's a multi-billion-dollar industry. And a lot of
John, you know what those recovery centers are doling out? Suboxone. Lots and lots of Suboxone. We advocate for people who can't get off Suboxone. It is a highly addictive, deadly opioid. And contrary to what doctors, ill-informed doctors on buprenorphine say, yes, you can overdose on Suboxone, but there's millions of dollars, billions of dollars invested in this false narrative.
Yeah.
And if you replace the word Purdue with Indivior, history is repeating itself this time around with Suboxone. But there's so much money being fueled into this fake opioid crisis. It's staggering. And every time we research, we find more corruptness. It's scary because now they want to approve buprenorphine as the first line of defense to treat chronic pain. But Dr. Feldman can discuss this as well. Buprenorphine is a terrible drug to treat pain. I have people who've done very well, heroin users who are now on Suboxone, and it's given them their life. But Dr. Feldman's wife is a chronic pain patient. She's not an addict, so she shouldn't be taking Suboxone. But doctors feel safer prescribing Suboxone than oxycodone because it's a different scheduled narcotic. But Suboxone is 10 times harder to get off of than oxycodone. You won't because of the long half-life. And this information isn't out there because of the money, because of Indivior, the makers of Suboxone. These people have a lot of clout. And it's just not Suboxone who's profiting. You've got, I call them drill mills, these poor pain patients. They're being forced to undergo costly, unnecessary steroid blocks, trigger injections, nerve ablations. Dr. Feldman mentored me through this whole process. It took me 3 months just to absorb everything that's done in a doctor's office with an injection. I get phone calls to advocate for people who are in the hospital howling in pain because they don't want to put in an order for pain medication.
What do you do when you run into that? Because I hear this all the time. They go down there, try to refill the prescription. Sorry, Mrs. Jones, you have 3 more days before we can fill that. And so, what do they do? Do they turn to street drugs? Because I've heard that.
Yes. And that's why prescribing is down by 43%. We have 50% less pills in our country. That's because the DEA slashed manufacturing. It's physically impossible to even overdose on pain pills. And that's why harm reduction is so involved, because they've interrupted the safe supply for an addict. And this won't make a lot of sense to a lot of people. It didn't at first to me, but an addict could get medication out of someone's medicine cabinet. Now they hit the street. The pain pills aren't there. The data, hopefully, the data's lied all along, but now the data released by the CDC, prescribing's down by 43%. Pills, there's 50% less being made in our country, and overdoses continue to skyrocket, and we ain't seen nothing yet. 2021 is going to be probably one of the hardest years for overdoses. We're seeing it. So the plan that pills,
Due to what?
Due to the illicit fentanyl that's killing people. That's the real culprit. And since I've been on the show, John, in June 2020, the AMA put out a 17-page scathing letter to the CDC saying, pull the guidelines. Overdoses are skyrocketing. What have you done? You know, you've got pharmacies, because what our country has done, they took the CDC guidelines and they turned them into regulation. And now the DEA is targeting doctors off of those CDC guidelines. You've got data analytics making decisions for you. So it's very involved. We know for sure pain pills, 2018, 2019, 2020 are not fueling the overdosing crisis. Illicit fentanyl, heroin, those are the in drugs right now. It's going to be a different drug in 2021. And cannabis is being laced with a form of fentanyl. You know, drug dealers are creative. They know they don't want their consumer to die. You've got to keep them alive so you can keep profiting.
Yeah. This lawsuit that you guys are doing, who is it benefiting? Who's profiting from it? What's your goal with this, and how can we help?
Can I answer that, Claudia?
Of course.
Mm-hmm.
And you know, somebody accused me. I remember this surgeon accused me one time. He goes, "Arnold, you're always talking riddles." Okay, so I love history, because history, whoever said it, those of us who don't learn the lessons of history are doomed to repeat them, right? But you can learn some interesting things about this. So the pain patients, which number in the many, many millions, tens of millions of chronic pain patients, you know, chronic back pain, big group, cancer pain, big group, sickle cell disease, not such a big group, but a sizable group, multiple sclerosis, trauma, lots of things, right? We have a big group. Now, why are we getting treated this way? Well, that's an interesting question, but we need a rallying cry. We need a rallying point, right? I'm here. You're in Hawaii. Claudia's in Rhode Island.
I was joking. I was wishing I was in Hawaii. I'm in California, but
okay. Well, you know, but you're far away from us.
Yeah. So
the rallying point in the Spanish-American War was remember the Maine. You remember that from grade school or junior high school? Remember the Maine. It was a U.S. warship in Havana Harbor. It's got sunk by the Spaniards, and then William Randolph Hearst, you know, put that all over his newspapers. Remember the Maine, and guess what? The Spanish-American War started not too long after that. Well, this guy Kolodny, I have to give this guy credit. He's a nefarious little man. And I saw this in the late 90s that this was happening. I don't know if I'm clairvoyant, but I've been around this rodeo. I actually called this guy up when he was working somewhere in New York. I said, listen, I fought my whole career to legitimize the treatment of pain, and you're about to destroy it. You know, I basically said, you know, go screw yourself. But, you know, he didn't pay attention to me. So Kolodny is going to be plaintiff number one.
And where's he at? Is he up in Rhode Island, Claudia? Or
well, he lives in New York.
Okay.
But he got himself a fake professorship at I'm ashamed to say, a Jewish institution named Brandeis University, which was named after Supreme Court Judge Louis Brandeis, which is heavily funded by Jews who understand, or should understand, what it's like to experience prejudice to this day. But remember, I said, follow the money. So Brandeis has this thing called the Heller School, which I don't know who endowed that. And I'll try to keep it brief. But what they've done is, when we were trying to treat more and more people compassionately, we begged for a database, meaning the doctors begged for a database, so we could see who were the real pain patients and who were the addiction patients. And the way we could see that is by pharmacy records. So we begged for what's called a prescription database. Well, what happens to the prescription database? Again, people see opportunity where we don't. We see opportunity to help people and they see opportunity to make money. So the Heller School gets a hold of this database and works with computer companies to use the data metrics to sell the metrics. Information is money. So they sell your prescription or my prescription or anybody's prescription, and God knows what happens to it. But let me tell you, what happens to it is pharmacies have to buy computer programs. The states have to buy computer programs. Hospitals have to buy computer programs. And the DEA has access to these programs. So they look at this data. And, you remember the old bell-shaped curve, right? If you're 2 standard deviations out from the back on the right of the bell-shaped curve, they target you for investigation. Investigation means seizure of assets under civil asset seizure laws. And guess what? They take a law-abiding, hardworking, compassionate doctor and turn them into a criminal and put them in the federal prison for 20, 30, 40. I know of 2 doctors got life sentences for practicing medicine. And El Chapo got a life sentence, but many other people get suspension, house arrest, public service, but they are out to ram this Suboxone so far up the American public's what, that they will never know what hit them, and it will take 100 years to undo this.
It's sad, and it sounds like a lot of the stuff that you're talking about is instilling fear not only in the doctors but in the patients.
Right.
And and they kind of feel that the I guess typical citizen feels that they're handcuffed, and they say, well, these are the laws. This is what I have to do. And I know you have another call here, Claudia, and I appreciate that. I wanted to help be on schedule here with you. What message can you share with our audience? What you like to do, and what coming on my show, and how we can help?
Well, first and foremost, hang in there if you're a pain patient. Just from this 1-hour show, what Dr. Feldman just explained about and we have doctors they'll never see the light of day. Those doctors are forgotten. We have to have a lawsuit filed in order to effect change. The same way the Department of Justice has made examples out of well-intentioned physicians, we now have to make examples out of people like Andrew Kolodny, who's an unscrupulous psychiatrist who's never put his hands on a patient.
Anna Lemke. Anna
Lemke. Yeah, these are horrible. These are ruthless individuals, and they're all with this organization PROP, P-R-O-P. And then you have organizations like Shatterproof, Gary Mendel, and these people are bringing in millions and millions of dollars, and they profit off your pain because they lost a loved one to an overdose. This lawsuit will make an example out of these people for, exploiting grief-stricken families and encouraging doctors to prescribe this highly addictive, deadly drug, Suboxone. And Andrew Kolodny was quoted as saying, I don't care how much bupe is on the street. The more, the better. And some doctors feel that way because it's a great tool for addicts. We're not addicts. I'm not going to be treated like an addict. I don't beg for medication, nor will I ever. But the lawsuit against CVS, if the judge approves this class of people who have been discriminated against at the counter, 5-10 years down the line, that will change policy. This lawsuit against Andrew Kolodny, Dr. Feldman, has a GoFundMe because we can't pay for the lawyers. The lawyers.
I was going to ask you, did you find a law firm pro bono that's going to go after these?
Oh, no. Lawyers will not take this on a contingency basis. It's far too expensive. Yeah. Lawyers will plow through a few $1 million. And Dr. Feldman has created the GoFundMe to help fund the lawsuit. That's necessary. We're not wealthy people. I think with litigation, legislation, we can put a dent in this. And eventually one of our senators, maybe it'll be my senator, Senator Sheldon Whitehouse, Senator Jack Reed. I've got 2 Congress people. We only have 2 in Rhode Island. One is in a wheelchair. He was injured by a bullet. He takes pain medication to manage his pain. And then we have David Cicilline, who's gay. And we advocate for people who have HIV and they can't get their pain medication. So you would think these people would, speak on behalf. And I've said from the beginning, we need 10 senators to speak out. Yeah. But when a senator tries, like Bill Cassidy, he gets shot down. They don't want to hear it. All they hear is opioid crisis. And that's the power of propaganda. So much propaganda. And, when doctors say, oh, opioids are never a good idea. And I said, well, opioids are never a good idea until you need them. Then they're a great idea. But we remain vigilant in this fight. To donate to the GoFundMe, you can do this by visiting. Dr. Feldman is on social media, Facebook. To donate to the doctor-patient forum, all of your donations are tax deductible. That's what's going to help me, when I'm in DC with Dr. Feldman lobbying, knocking on senators' doors, getting doors, slammed in my face.
Literally?
Yeah, literally. Well, that happens every day anyway, John.
Yeah. John, what they're able to do now is hide behind. You'll have to go onto our website and make an email appointment with our scheduler. So, they hide behind electronic wizardry. And I remember telling one of my senators, Mississippi's also a small state, and I used to be friendly with Trent Lott, who was a very well-respected senator in the South. And I remember telling him a long time ago, Trent, I elected you, not your email. But that's how it is. And so what we want to do, aside from this lawsuit, which we will do, God, how do they say, God willing, we will have a Washington presence 100% of the time. And, do we like lobbying? Not necessarily, but we have some serious issues that affect, many, many millions of Americans from all walks of life. And we want those issues front and center. And that's the only way I see that it's going to happen. We don't advocate, obviously, for violent revolution or burning down buildings. But, I can see the Million Man March. Remember that from many, many years ago. I can see the Million Pain Patient March. And that's what I would like to see, where people say, this is a group of people that are deserving of consideration. That's what I want to see. So, I've been on this earth, a number of decades, and I worked my whole life to try to make the treatment of pain legitimate, only to have it vaporized by a bunch of computer companies and pharmaceutical manufacturers. And that's what we aim to change. But one other thing I want to tell your listeners, if you have a good doctor, if you have a concerned doctor, try to make their life easy. And, a lot of this stuff is nonsense. Try to put up with the nonsense, but, be a compliant patient. So if any DEA agent comes to your doctor and says, let me see the record for Mary Jones should be a compliant patient, within the confines of unfortunately, the Controlled Substances Act, which is now the Bible for doctors to follow for treating chronic pain patients. Never happened before. But that's how it is today. So the other thing I'll say is, we like to advocate for people. It's kind of difficult sometimes because it's kind of like Claudia and I and a couple other people. But, we're anxious to help you hear your stories, try to recommend for you things that can help you survive this really pain patient. She calls it, I call it a pain patient holocaust. What do you call it? Pain patient genocide. Same thing.
Pain patient genocide. Yeah. It's...
Well, I thank you both for doing what you're doing, but also standing up for the patients that don't have a voice, standing up for the doctors that don't have a voice, and some of these senators, that I may be too afraid to speak out and speak out and speak up. So, Claudia, always great to see you. Dr. Feldman, I appreciate you.
Hey, thank you. I consider we're now friends.
Right back at you.
Yes, sir.
God bless you, my Jewish Catholic friend.
Yes, sir. How about that?
Hey, I'm going to throw a Merry Christmas out to you, but happy holidays.
Thank you so much. Merry Christmas.
Too, and,
yes, sir.
And we'll get your links. And so, Claudia, if you can get me all the links for Dr. Feldman as well, I'll put this on the site, as well as when this goes out. I'll let you both know, of course, and we'll get it out to you. Remember.
All right,
All
John.
right.
Thank you. Merry Christmas.
John,
Talk
thanks again.
soon.
Very nice meeting you both. And
Yes, sir.
See ya.
Adios.
Bye.
Bye-bye.
Bye now.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at UPatientsGroup and on Facebook at United Patients Group, as well as for our podcasts. Please click the link in the description below. We'll see you there. Bye-bye.